Welcome back, my dear students. Today we will learn about tuberculosis, a serious but curable disease caused by Mycobacterium tuberculosis. It mainly attacks the lungs and spreads through the air when an infected person coughs or sneezes. TB or tuberculosis can be cured with proper medicines. Good habits like covering your mouth and finishing treatment helps stop its spread. So let's get started and learn how to fight tuberculosis with awareness, treatment, and good hygiene. Tuberculosis is basically a chronic infectious disease mainly caused by a tiny bacterium called Mycobacterium tuberculosis. It mostly affects our lungs. This is called pulmonary TB but can sometimes spread to other parts of the body like the brain, bones or kidney called as extrapulmonary TB. Extrapulmonary TB. If TB is detected early and treated properly, it is completely curable, but if patients stop medicines halfway, the bacteria can become drug resistant, making it very hard to treat. This is a big public health challenge. Mode of transmission. How does TB spread? Airborne droplets. When a person with active lung TB coughs, sneezes, talks or spits, they release tiny droplets containing Mycobacterium tuberculosis. These droplets can float in the air for hours, and if someone nearby breathes them in, they may get infected. Important: TB does not spread through food, water or touching things, only through the air. Who is at high risk? People who stay close to TB patients for a long time, like family members or nurses, living in crowded places with poor ventilation like slums, prisons, etc. TB is not highly contagious like the flu. Short casual contact usually doesn't spread it. It needs prolonged close exposure. Pathogenesis. How TB develops in our body. Entry. TB germs enter the lungs when we breathe in infected droplets. Primary infection: if the germs reach the alveoli, the tiny air sacs in our lungs, and are swallowed by immune cells like macrophages, but these marked bacteria can survive inside. Body's defense: after about 2 to 8 weeks, our body's T cells and macrophages fight back. They build a protective wall called a granuloma or tubercle to trap the bacteria. Possible outcome: latent TB, bacteria trapped and stay sleeping, no symptoms, no infections, but the germs are still inside. Primary progressive TB, sometimes especially in young children or people with weak immunity, the infection doesn't stay contained and spreads immediately. Reactivation or secondary TB in adults, latent TB can wake up years later if the immunity drops due to HIV, malnutrition or old age. Tissue damage: TB can cause caseous necrosis, that is dead tissue that looks cheesy under the microscope. Holes or cavities can form in the lungs. These help bacteria spread to others when the patient coughs. This is pathogenesis of tuberculosis. So this image shows the pathogenesis or development process of tuberculosis in our body. On the left we see a person coughing. This represents how TB bacteria can spread from the lungs through droplets when someone with active TB coughs. The highlighted lungs shows the main site where TB infection usually starts, inside the alveoli or tiny air sacs. On the right side there is a detailed diagram showing what happens at the microscopic level. First, infected alveolar macrophages. When TB bacteria or Mycobacterium tuberculosis are inhaled, they enter the alveoli and infect special immune cells called alveolar macrophages. These infected cells trigger the body's immune response. Granuloma formation happens when immune cells or macrophages or T cells surround and trap the bacteria to stop their spread. If the bacterial immune system is strong, the infection stays under control. This is shown as latent infection, where bacteria are present but inactive. If the body's defense weakness, like in HIV or malnutrition, the bacteria can reactivate, leading to active disease. In active TB, the granuloma can turn into a necrotic granuloma, that is dead tissue area, which breaks down and releases TB bacteria again, causing further spread through coughing. The arrow shows the possible outcomes: control or latent TB or progression to active TB with possible reactivation later if immunity drops. Now we should study the management procedure. Diagnosis: watch out for these signs: long lasting cough just more than 2 weeks, coughing of blood like hemoptysis, fever, night sweats, unexplained weight loss. Test: sputum near microscopy checks for acid first bacilli or AFB. Sputum culture, the gold standard but slower. CBNAT or gene expert rapid test detects bacteria and bacterial resistance. Chest X-ray looks for cavities or lung lesions. Tuberculin skin test or Montauk's test help find latent TB. Treatment: main role, take the full course of multiple drugs to prevent drug resistance. First line medicines are HRZD. H means isoniazid, R means rifamycin, Z means pyrazinamide, and E হচ্ছে ethambutol. Standard dots are directly observed treatment regimen. Intensive phase 2 months HRZD daily. Continuation phase 4 months HR only. Longer treatment needed for TB in bones, brain, etc. What if TB germs become stubborn? MDR TB. MDR TB means the bacteria resist main drugs. Treatment needs second line medicines like fluoroquinolone or newer drugs like bedaquiline and delamanid under special care. Supportive care: good nutrition, treat other diseases like HIV, watch out for side effects like especially liver problems. So prevention and control: how can we stop TB from spreading? Find and treat cases early breaks the chain. BCG vaccine given to babies in many countries protects kids from severe TB. Good ventilation, cough etiquette, wearing mask in hospitals or when around patients, contact tracing, screen people who live or work closely with TB patients. I hope this class helped you understand tuberculosis, how it spreads through the air, how it hides inside our body, and how early diagnosis, proper treatment, and good habits can stop it completely. Knowing this keeps you and your community safer, especially in crowded places where TB can spread easily if we are not careful. If you found this lesson helpful, please like, share, and subscribe for more clear and simple biology topics. Keep learning, stay curious, and always remember: covering your mouth when you cough, completing your treatments, and helping others get tested can protect lives. See you next time, and thank you for learning with me.